Alvaro Avezum. I'm from São Paulo, Brazil. I'm a cardiologist and the director of the research division at the Dante Pazzanesi Institute of Cardiology. Well, usually we must go back to the literature and our data from our countries, and you can see that the mortality from cardiovascular disease is still high, especially in low and middle income countries. For example, in Brazil, the #1 cause of death is acute myocardial infarction and stroke. So we do need to review those policies in order to implement cardiovascular health programs and try to minimize and improve the burden of cardiovascular disease in Brazil. Well, recently we have some data from different countries in the world, including Brazil, and the patient after MI, 5 years after MI, the proportion of patients that they are truly utilizing medication, evidence-based medication, is extremely low. Simple intervention like antiplatelet, beta blocker, ACE inhibitor, or statin. So based on that, we needed to get with a new proposal and try to have more patients using the medication for long term in a sustainable way and not only pre-discharge. So we still have a long way to go, but at least we know our numbers and we can improve it through a very efficient program directly to those patients. Well, at the beginning we had a lot of data from hospital, and only by understanding the data from hospital is not enough, because at the community level we don't know yet about the burden of cardiovascular disease. So after discharging the patient with myocardial infarction or stroke, we must try to get the best possible evidence-based medication for this population. And right now, we don't have this intervention in a very efficient approach or in a very efficient way. So we believe that the 25 by 25 program from the World Heart Federation is a unique opportunity to engage the Brazilian community and try to reduce the burden of cardiovascular disease in our country.